Hello everyone, I am Dr. C.P. Ravi Kumar. I am a consultant pediatric neurologist at Aster CMI Hospital and Aster Whitefield. This video I am going to speak about EEG. EEG, that is electroencephalogram, or somebody may say electroencephalograph. So what is this about? This is an investigation we often do in children and also adults who have epilepsy or who have had seizures, or even when there is a doubt we may have to do it. So what is this test about? Basically, it is nothing but recording the electrical activity of the brain. Most of you as a parent might have had a ECG, that is electrocardiogram, means recording the electrical activity of the heart for insurance or for health reasons. It is the same thing which we do on the brain to record the electrical activity of the brain. It is quite a safe procedure. It does not carry any risk. It does not cause any harm. There is no pain. So that is the best thing about this investigation. But the challenges of doing an EEG in individuals are quite a few. So let me share a few tips on how to handle this. First of all, this test is usually done in a hospital or a diagnostic center. It needs few simple preparation. Make sure the air is washed with simple soap, no moisturizers, no hair gels. And if you can avoid putting the braid, means pleating the hair, it is good because you have to apply the leads. So if you have pleated your hair very beautifully, you may not like it when we have to put the gel. So how do we do this test? It is a simple electrode where we place on the head at certain positions. To make sure the electrical activity of the brain is well recorded, we have to use some gel and sometimes an alcohol-like solution to clean the hair so that the oily secretions from the skin, from the air is all clean and the electrodes attach very well and it records well. Usually after the test is done, it's best to have a shower and clean your hair with the soap and shampoo, but nothing else to worry about. This gel and the alcoholic solution we use are day-to-day things and it usually does not cause any problems, and so far I've not seen any of those happening. Now what else can we do in children where you can prepare the child to have the best kind of investigation or the best yield from this investigation? Make sure the child can sleep. An ideal EEG should have both the awake and sleep record. Children obviously do not sleep when we want, that we all know very well of. The younger the child, we can time it when they have the sleep time. Say some children have an habit of sleeping from 2 to 3. Okay, you speak to the technician, speak to the doctor and try to fix your appointment around that time. So a little bit of older children, wake them up very early so that when they wake up in the morning they're already tired and sleepy, and when they come to the EEG room they should ideally sleep well, so that makes it easy. Make sure they don't sleep when you're coming to the hospital or the diagnostic center, especially when you're driving in the car. Most of us nod off. Make sure the child doesn't sleep, because this is a common problem we see. They sleep very well in the car, and in the hospital when they come for the test they are fully charged and running all over the place, so that defeats the purpose. Make sure they're a little bit tired so they come and sleep, and it helps. How long does the test take? Now, sometimes we do what is called a routine EEG. Routine EEG means usually internationally it is accepted as 20 minutes. Ideally, it should have awake and sleep. But as you know, in children, 20 minutes, children will not follow our instruction. They will not sleep and they will not wake up. So we end up doing it for a longer time. Sometimes it is done for hours. It is called a prolonged EEG. As the name says, prolonged. It may be 1 hour or even 24 hours. In addition, there are a few other things which we have to do. One is something called video EEG. So I can say very in a positive way, Aster CMI and Aster Whitefield has a video EEG facility where there is a video and the electrical EEG being done at the same time. It is synchronized. It is not required for everyone, but where it is required, we can do it. The advantage of this, especially in those parents who have babies, who have some abnormal movements, they're worried something is happening, but many a times the tests are coming normal. For reassurance and also for confirmation, we can do this EEG, what we call video EEG, where the electrical activity is recorded at the same time the video is synchronized. You can relate the events with the electrical activity of the brain, and this makes wonders. Many times we can prove this activity is not abnormal, this is not a seizure, and it brings a great relief to parents. At the same time, many of these abnormalities we are not sure whether it is really abnormal or normal, and a video EEG will confirm that this is definitely abnormal. It will guide us for the right treatment. So it's very important for us to do the investigation in the right way. One thing I wanted to also highlight is there are certain things we do when we do the EEG. It is called activation procedure. Two common things we do. One is called hyperventilation, where we ask the individual to breathe fast, deep and fast. This is considered to be a trigger. If there is any abnormal activity in the brain, it can come out and it can be picked up easily. One of the commonest types of epilepsy is called absence epilepsy, where this hyperventilation brings out these abnormalities, and it is a standard procedure to do this in every EEG. Obviously, you can't do it in younger children. The technician will know at which age we have to do and we cannot do. The second activation procedure, which is done as a routine, is called photic stimulation. There is a flickering light which is at certain frequencies. Simple example or something I can correlate is the disco lights, where it comes on and off. It is put on the child or put on the eyes at a certain frequency. It is also a trigger to bring out any abnormal electrical activity. These two are usually done as a standard. The photic stimulation cannot be done when we do portable EEG because the machines are not designed for that. So just be aware, if somebody does it bedside, many times it cannot be done, obviously because of the limitations of the way the test is done. Now, what are the other things you need to be aware of? So once the test is done, it will take usually 24 hours to get the results. Nowadays, what we find with parents is, one of the reasons why I made this video is, parents are very demanding. You do the test, they come running, where is the result? So it doesn't happen that way. We need time to look at the graphs and give you the results. Sometimes people who may be watching this video, whom I might have given the results very quickly, what you need to understand is sometimes there are certain scenarios or sometimes it is emergency, we have to look at it quickly and give you the results. And sometimes the graph is so abnormal, you don't really need time. You just look at it, you know this is abnormal and you can give the result. So individual scenarios are different. So be aware of this so that you get the good quality result. One of the commonest questions parents often ask is about the cost of the investigation. What I need to say is, if you use the right machine, you get the right results, you get the right treatment. The important factor about EEG or epilepsy management is the medicines are usually given for 2 years. Means if the child had a seizure today, you have to give medicine for next 2 years. Provided they had no seizures for 2 years, then you think of stopping the medicine. So always think what is important, getting the right test or getting the cheapest investigation. In addition, a trained technician. Obviously in hospitals like Aster, we have trained technicians who are specialized in doing just this kind of investigation. So all this makes a huge difference, or a hell of a difference. There's an old saying in English, penny by wise, foolish by pound. So keep this in mind when you choose where you have to do the test and how you have to do the test as well. It is not like it has to be done quick, and it's not the cost that should influence your decision. Wherever you go, certain tips, what I've said, applies to everyone. I wish you all the best. And if you have any doubts, please send a comment. I'll be able to help you out. Thank you.